2020 has been an incredibly busy year for frontline healthcare workers. That includes 911 dispatchers and EMS workers. Some are the first to respond to a patient struggling with the effects of COVID-19. And tonight's Eye on Keloland, Bridget Bennett shows you what the pandemic has been like for these first responders.
Is her breathing completely normal?
With any respiratory related call, you can usually hear if they sound in distress.
It's a call first responders have heard this year more than ever before.
We have seen an increase overall throughout all of 2020 for respiratory related emergency calls.
Here in Sioux Falls, about 20% of our transports since March have either been COVID or COVID suspected type calls.
Just stay on the line and I will tell you exactly what to do next.
The 911 dispatchers serve as the first line of care for COVID patients.
Do what you can to keep their anxiety down, talk them through to make sure that they calm down their breathing.
Whether they're in quarantine on their own or trying to prevent infecting a loved one or neighbor, many COVID patients end up calling 911 themselves.
A lot of times it's people that are alone, and you'll stay on the phone with them and reassure them that help is coming and coming as quick as they can.
The biggest thing is really that paramedics assessment and getting, their eyes on the person and seeing if they're in that situation where they need to get to the hospital quickly.
Paramedics are the next line of care for patients struggling with the effects of COVID.
You can definitely give oxygen therapy, breathing assistance. We have anti-inflammatory medications and different types of breathing treatments depending on the severity of the case to kind of bridge that gap until we can get to the hospital.
This year, Patient Care EMS Chief Operating Officer Damian Gonzalez says paramedics are prepared for anything when responding to a COVID-related call.
There is a large range of severity with this illness.
But as COVID numbers surged this fall, so did the severity of their 911 calls.
Does anyone there have any recent flu-like symptoms, tested positive for COVID, any pending COVID tests in the household?
Dispatchers know their first responders are at risk of getting exposed to COVID on a daily basis.
We screen every call, whether it be an animal control call or a medical related call. And since March, we have had over 250,000 calls that have been screened.
I got my goggles there too.
Those screenings give paramedics a chance for even more protection.
The biggest difference, I would say, for our EMS providers is having to have that increased level of alertness for protecting themselves and being ready to treat these patients that have COVID or suspected COVID.
This year, paramedics wear a mask to every call they respond to. But if the patient could have COVID, they're putting on full PPE protection.
Having to talk to people and give care and show care through a mask and through a gown. So that's another piece, that human element that's kind of had somewhat of an effect on the care providers, because that's part of the reason that they're in this industry, is to take care of people.
While the job may look very different this year, the goal of first responders remains the same, even through the pandemic.
Everybody goes home safe and not bring COVID home to their household, or also bring it into a citizen's house if they're trying to help.
With Eye on Keloland, I'm Bridget Bennett.
While their respiratory calls are up, first responders say their call volumes have not increased this year, in part thanks to a drop in traffic-related emergency calls as people stayed home at the start of the pandemic and continue to see more people quarantining at home during the surge this fall.